and welcome. I am Deputy Premier Mike Ellis, Minister of Public Safety Emergency Services. Joining me are Minister of Mental Health and Addictions, Rick Wilson, as well as Carrie Bales from Recovery Alberta. We're here today to provide an update on the drug consumption services in Alberta. The government has been very clear from the start. Addiction is a healthcare issue that requires treatment and recovery-focused supports. And a health system works best when it helps people heal and get well instead of leaving them in the cycle through a cycle of crisis and, of course, struggling. We don't want that. This is a foundational principle of the internationally recognized Alberta model. Over the past several years, Alberta has deliberately shifted towards a system that focuses on treatment and recovery. The government has made significant investments to help more Albertans pursue recovery, and we are seeing success. Since 2019, we have increased publicly funded addiction treatment bed capacity by 55%. We're also the first province in Canada to offer immediate, voluntary, evidence-based opioid treatment to individuals in police custody through the virtual opioid dependency program. And across Alberta, 11 recovery communities are being built. 4 already open, and 5 Indigenous recovery communities are expected to open later this year, adding another 375 beds to the system. Once all 11 recovery communities are operational, more than 2,000 Albertans will be supported every year in the pursuit of recovery. We're also building 2 compassionate intervention centers, one in Calgary and one in Edmonton, each with a capacity for 150 beds. And while the opioid-related overdose deaths can fluctuate from month to month, Alberta has experienced about a 39% decrease since the peak in 2023. This progress didn't happen by chance. It happened because Alberta chose to invest in building a system of care that prioritizes treatment and prioritizes recovery. And we know the Alberta recovery model is our solution to the addiction crisis that has ravaged our families, our communities for far too long. We've seen similar results in our correctional system where access to treatment is immediate and recovery is possible for everyone. In provincial correctional facilities, nearly 5,000 people began treatment last year, and there have been 0 deaths from drug overdoses for 3 consecutive years, with individuals completing therapeutic treatment programs and pursuing recovery. The lesson is clear: when systems are designed to move people forward, lives are saved. These outcomes matter, and especially when we're talking about drug consumption services. Consumption sites were introduced at the beginning of the opioid crisis as a short-term emergency measure. Treatment options and recovery support then were far more limited than they are today. So now, through the internationally recognized Alberta recovery model, we have significantly expanded treatment capacity. We've removed financial barriers to care, invested in detox and stabilization treatments, and established new recovery-oriented services. And it is working. Peer-reviewed research conducted here in Alberta by the Canadian Centre of Recovery Excellence examined what happened after the Red Deer overdose prevention site closed last year. And the study found that overdose deaths did not increase, emergency room visits did not spike amongst the users, and more people accessed treatment and recovery services. Albertans have been clear with us that they want compassion for people struggling with addiction, and they won't accept the community and public safety impacts of drug consumption sites. You can care deeply about people battling addiction and still believe that communities deserve to be safe and a safe place to live and work. Our government refuses to pretend that one must come at the expense of the other. So today, I am announcing that Alberta is ending the drug consumption services here in Calgary and in Lethbridge, and these sites will stop operating at the end of June. Government funding will be reinvested in recovery-oriented supports that respond to overdoses, connect people directly to care, and steer them into treatment. People will not be left without support. This decision is also about taking pressure off the healthcare system. Leaving people in sustained addiction is not working for our health system and patients, families, and of course, even our frontline staff. When people are stuck in the revolving door of crisis instead of getting real help, hospitals can become overwhelmed and ambulances tied up. By strengthening community outreach, withdrawal management, treatment pathways, we're making sure that people are getting the right care and, of course, in the right place. Decisions are being made based on evidence, capacity, and local community needs, and anyone struggling with addiction deserves a real chance at recovery. And our communities and businesses expect and deserve public safety. The Alberta Recovery Model is about doing both and doing it better. So thank you.